Luis Camacho, 17983351. A 30-year-old Jehovah's Witness female patient was admitted to our ward due to mild shortness of breath. The patient's blood test result highlighted that the hemoglobin was mildly borderline low, in which she needed a blood transfusion, but couldn't due to religious reasons. In this scenario, the ethical context that influenced my patient's outcome was her autonomy of refusing to receive the blood transfusion. Coty et al. Defines autonomy as a process to which patients' values and preferences are considered in which they are involved in the decision making. In this case, her autonomy was that she was strictly refusing to receive blood transfusion due to her religion. As a result, this could potentially cause further suffering from shortness of breath as she was not able to receive the beneficence of the proposed treatment, which could have led to a better and positive health outcomes. The outcome of refusing blood transfusion in this scenario can affect the patient in many ways. In this case, the beneficent concept of doing good suggests that the best practice for a patient with low hemoglobin is to receive a blood transfusion. On the other hand, a study by Ringnes and Hegstad states that Jehovah's Witnesses' refusal of blood transfusion is a religious reason rather than a medical one. Therefore, naturally as a nurse, my best advice for their beneficence and better health outcome is to receive a blood transfusion. However, if we look at this in a holistic point of view, we are able to identify the patient's concerns. In this case, the social aspect of receiving blood transfusion could mean that the patient could be disowned from their families or the church community, as cited in Bach 2012. Spiritually, the blood transfusion would mean that the patient's spiritual beliefs will be compromised. Also, mentally, the conflict between her beliefs and the treatment can create pressure towards her mental health. I recognize that going against her belief can further put a strain amongst the other aspects of her health that can later cause other issues. As a result, by recognizing these aspects, it is evident that patient Y valued her religion more than her health due to the effect of the treatment to her other well-beings. Therefore, I have decided to advocate for patient Y's autonomy to the medical team about her situation so that they can provide other solutions. Through critiquing these ethical issues, it is clear that autonomy should be adhered in this scenario, due to the fact that the damage to her other well-being could be worse than the physical beneficence aspect of this treatment. In terms of my personal nursing philosophy, I believe that it is important for nurses to follow a person-centered model of care. Person-centered care can be defined as a care where decision is guided by the patient's preference, beliefs, and values, as cited in Morgan and Yoder 2018. Therefore, by providing a person-centered care to patient Y, I was able to understand the patient's values such as the spiritual, social, and mental aspect of their health. Utilizing a holistic view of the patient allowed me to recognize that receiving the treatment would only cause more damage to her well-beings. So Kefli 2017 states that involving the patient in their care plan will result in the formation of trust, which can ultimately increase the patient's care and outcome. As a result, I decided that the best nursing practice for patient Y was to advocate for her and inform the doctors that her religion is strictly against blood transfusion. Therefore, by advocating for patient Y's autonomy through the use of PCC, I was able to create a safe environment for her to practice her beliefs while the doctors seek for an alternative treatment such as changing her diet. Kirksky 2018 supports the importance of patient autonomy in terms of being part of the decision making. In this article, it also states that being part of the decision making enables effective nurse to patient communication in terms of addressing issues such as their cultural, religious, and community needs. Thus, through this action, a form of trust will be built, resulting in a better interpersonal relationship, which can lead to better adherence to the change of diet as a treatment, thus resulting in an overall positive health outcome. Overall, this experience allowed me to better understand the patient as a person and not as a diagnosis. This impacted her health by having a positive result without compromising her overall well-being. This leads us to the question, What is more important? In this situation, patient's wise overall autonomy outweighs the beneficence, and as she was still able to slowly receive the alternative treatment due to the fact that blood transfusion was not the only solution.